on the Micah Sims Show, we are concerned about your health and your living. So we've decided to install a new segment here on the Micah Sims Show called Healthy Living. And I decided to bring one of the best physicians in town from the Einstein Hospital, Dr. Donee Patterson, on to help us understand what we need to do when we visit our doctors. Hey, Dr. Patterson, how are you?
I'm great, thank you.
Thank you for taking time out of your hectic and busy schedule to come down here, because I think it's important that our viewers understand they need to do everything possible to improve their living.
Absolutely.
And you do a great job at Einstein. You're the director of
Medical Community Outreach. I'm a physician, but I'm also the director of Medical Community Outreach.
And what does that entail for you?
So it means I go on the front lines. I go out to different faith-based organizations, whether it's churches, mosques. I go to high schools. I go to middle schools, elementary schools, malls, wherever I'm needed, just to get the word out about health. I think for the most part, if you just ask anyone, even here in your audience today, if you ask them, do you have a medical question? People at least have 3-4 medical questions. So
I got about 7 for you, but I know you can't stay all day.
Exactly. So we care enough about your health that they're actually sending a physician out that I can answer questions. I can, talk about things that you may not have time to talk to your doctor about, just because we care so much about your health.
How long has Einstein been doing this initiative, this kind of outreach in the community?
I've been with Einstein not quite a year. Okay. They have lots of community service. There's other physicians who do go out. But I'm the first director of Medical Community Outreach, and so we're trying to do a major push just to make sure that the people in our area are educated.
When you go out, is there a different focus every month? Do they change it up? Is it on healthy eating? Does it change on per month?
It does vary. Different months have themes, and sometimes we go around the themes: prostate cancer month, or colon cancer awareness month, breast cancer awareness. But when I go to a place, I definitely want to know, well, what are some of the issues? And so there might be all older women and they want to talk about menopause. There may be younger teens and they want to talk about STDs or tattoos and body piercing. We talk about a lot of different things.
I got to bring you back for the tattoo and body piercing thing. We
Absolutely.
definitely need to have a conversation about that. Today, I brought Dr. Patterson on because I think it's important that when we go visit our doctors, we get the maximum out of the visit.
Exactly.
The maximum. We need to get everything I can out of that 30-minute, hour and a half. How long should our doctor visit be?
Well, most people don't think about it this way, but most doctor visits are about 15, 20-minute intervals. And if you have multiple medical problems, you need to understand that. Sometimes it's more. And definitely for physical exams, it'll be a little bit more.
Okay.
But you can get everything you need from that visit. But I find so often people aren't prepared, or they come and they're just waiting for the doctor to speak, and that'll happen as well.
Right.
But there is a way that you can maximize your time and have an efficient doctor's visit and leave with everything you need to know. And I think that people need to be taught that. It's not common sense all the time.
Yeah.
It's some things that may seem simple, but it's not always common sense, and we need to teach people how to make their visits very effective.
All right, in a quick minute, give my viewers some things that they need to be doing when they go visit their doctor.
First of all, please be prepared.
Okay.
So people don't always come prepared. They don't know their medicines. They don't know what their other doctors are. They may have a cardiologist, a urologist. They don't know their names. They don't know their numbers. They don't understand their allergies. So just come, be prepared. If you don't have time to write down all your medications, just put them in a bag, bring them for your doctor, so your doctor can look at it. Write down all your specialists. If you have a cardiologist or urologist or a nephrologist, make sure you have all their names and numbers written down. And make sure you know your allergies, and if you're taking herbal medicines. People forget to mention to their doctor that they're on birth control or that they're on herbal medicines. All those things count for us, because if we're prescribing, we don't want to give you something that interacts with that. Okay. So second, after be prepared, that's number one.
Be prepared is number one.
Number 1, 2, 3, 4, and 5.
Okay.
Be prepared. But after that, you really want people not to save their questions for last. Often people have questions that they want to ask me, and then they save it for the end of the visit. So if I'm in there with someone for 30 minutes and we've addressed their high blood pressure, diabetes, and then at the end they say, well, I have a rash or I have back pain, you're not gonna get the full attention that you need.
Okay.
So don't save your questions for last. Make sure you put it right out there, and when you bring your questions, I highly recommend people write down their questions. Bring your questions, show them to your doctor right when you walk in. So don't save your questions for last. And then lastly, if I could say 3 very important things, the last thing would be to make sure you're very clear about what the doctor expects you to do before your next visit.
Okay.
So people leave, and then they're told to follow up in 3 to 4 months, and they come back.
Like their homework.
Like their homework.
Okay.
I call it the honey-do list.
Okay.
I give my patients honey-do lists.
Okay.
And when they come back, they haven't done it because I think my patients do it. But often people don't remember that I expect them to do blood work. I expect them to call their cardiologist. I expect them to start XYZ medication. And if you haven't done it, then our next visit won't be effective either.
Right, yeah.
So do your homework before you come back for your next visit. If I could just add one more thing, I would...
Sure, you're the doctor. I need you to add.
I appreciate that. If I could add one more thing, I would say if for whatever reason you leave and you're unclear about, you thought you had it all before you left, but you go home and you're unclear, call your doctor back. Don't wait 3-4 months. Call him back and say, I wasn't clear about this. Can you clarify? Even the nurse can call you back and just say, yes, you take this medicine twice a day. I would so much rather you call me and be clear about how to take that medication than for 3-4 months be taking it wrong or not taking it at all.
Makes sense. All right, well, more of these tips. Dr. Donee, where can they go? You're going to give out a website?
Absolutely.
All
You can go to drdonee.com, or if you have questions, you can call 1-800-EINSTEIN and come and see us in the office.
All right, we're going to make sure that we put those tips up on our website. So in case you missed any of it, you can't get to Dr. Donee's website, which you should be able to. We want you to do that. You can find it on MicahSimsTVShow.com. Dr. Donee, thank you. Hopefully we're going to get you to come back every month.
I would love that.
Tattoos and piercings, I got to have a conversation about it.
I've been doing that talk for 10 years, so bring me back.
All right, we're gonna have him back. All right, thank you, Dr. Donee.
Thank
We got
you.
more of the Micah Sims Show coming up.